So at GD, our core purpose is to improve the health and well-being of the public at large by providing what we call responsive innovation to EMS and hospital care teams. And to us, that's all about our technology enabling them to provide better patient care, to give better outcomes, helping their patients in the communities that we all live in. eBridge is our mobile telemedicine or telehealth app. It connects first responders such as EMS and fire departments with the hospital, emergency department, and throughout. So for example, managing a patient with stroke or heart attack with voice and text and pictures and video clips and medical data shared between those providers about that patient that helps them either treat the patient on scene, transport effectively to the right destination. It's all about right care at the right place in the right time, and reduce that patient handoff time and reduce time to treatment once they hit that hospital door. Better outcomes, save more lives. CAREpoint is, you can think of as a portal for connecting hospital emergency department with everything EMS. All communications in the form of voice and data and telemetry and telehealth. It's at one point where ED staff can go, so if it's a radio call, if it's a phone call, if it's a 12-lead EKG that got sent in, whatever that information they need to be best prepared for that patient when they arrive, shorten that handoff time, document, record, and share with the internal teams at a hospital to speed that care and make it the most efficient they can. CAREpoint 3 is the next generation CAREpoint workstation. It builds on the power and legacy of all that CAREpoint can do, being that portal to EMS and fire departments in the field, yet on the technology platform of today. So less hardware dependent, more available for seamless patient care because it integrates our D-Scribe X, which is the same log recorder database that eBridge uses. So it's all in one platform. It has mobility capabilities to allow it to be used on a mobile device elsewhere in the emergency department, and is expandable, much more so than in the past. D-Scribe, and the newer version, D-Scribe X, is our intelligence hub, if you would. At its core, it's a digital log recorder with powerful reporting capabilities. So all the interactions on either CAREpoint or eBridge with EMS and fire in the field back to the hospital side are documented for QA purposes, for medical legal purposes, and risk mitigation. Today, telehealth can be used in a variety of ways. It can be used to enhance the patient care that EMTs and paramedics are providing in the field by being able to consult with a nurse or physician at the hospital. It can be to improve decisions on where to transport to, and it can be even used to make decisions to not transport and treat, what they call treat in place. There are aspects of EMS today, mobile integrated healthcare, community paramedicine, where it's about managing the patients at home and not transporting to the hospital. And telehealth is one of the tools that allows that to happen. Our users can expect a range of ROI in different forms. Of course, multiple levels of cost savings, but perhaps more importantly, improvements in care through reduced time to treatment, improvements in handoff, reduction in risk and exposure on the medical legal side. Overall, smarter, seamless patient care. GD solutions address a range of needs, from simple communications like alerting and notification that they're going to be arriving with a patient, all the way up to alerting acute care teams and activating cath labs and neurology teams for strokes, and everything in between. Could be a simple document of a refusal. It could be telehealth, better managing a patient in the home or en route. Is a core value at GD. It goes back to our roots and our DNA as a very engineering-centric company, that we develop technologies, and an earlier version of that was responding to the changing needs of our customers. So being responsive and providing innovation really embodies, what we do. What makes GD's solutions better than others? Well, 30 years of experience of providing these solutions in mobile public safety environments, which is the hard place to do it. We've learned from our users and our customers that no two systems work the same, that the solution and technology needs to be highly configurable so that they can use it efficiently and easily the way they need it to operate to best take care of their patients in the least amount of time.